Your Excellencies, my colleagues, Ministers of State, ladies and gentlemen, it's a pleasure to be here, and I want to take this opportunity to thank the organizers, the sponsors, and our hosts for this opportunity for us to share, to learn, and to earn a lot from just 2 days. My task would have been very easy because I'm just called upon to give you a few words on how Ghana is innovating in trying to mobilize local funds instead of depending on the aids and our donor partners. But unfortunately, being the last speaker of the last session of the first day of such a forum, I am also called upon to try to sustain your attention. I can see diminishing returns in many, but I hope you spare me just a few minutes. I just have a few slides. My presentation is just to give you a flavor of what you get from the Chief Executive Officer of the Ghana National Health Insurance Agency, Authority, who will be presenting the Ghana story tomorrow. And so I will just give a few slides on it, even though I'm not John the Baptist, coming to prepare the way for Jesus. I have to give you the background of where we came from since independence and a few milestones that we made on the way to establishing the National Health Insurance Scheme in Ghana. And you see that from 1957 to 1966, we had a free healthcare policy. Definitely, you all recall our first republic was a socialist government, and therefore everything was taken on by the state. But as we went along, we definitely faced the huge challenge of sustainability, and therefore it was one of the reasons why there was a military takeover in 1966, because there was a downturn in the health service delivery, and therefore immediately the military handed over to the Second Republic. The idea of social health insurance was mooted by that government, which also was given just a few months to survive, and the military came in again. And since that era, we've had a lot of military adventurism in the country, and things went very bad. And in 1985, in order to prevent the total collapse of the health sector, we had to bring in the user fees, and which meant that a lot of out-of-pocket payments were made by beneficiaries of the service. And it was definitely an era where you can talk about catastrophic payments. And so around 1998, we started the pilot schemes of trying to see how social health insurance could be instituted in the country. And that time, I assure you, we had a lot of doubting Thomases, including the World Bank, who thought that we couldn't make it. And we prod along, and by 2003, we came with an act of parliament and established a national health insurance scheme. Now, the earlier period, because of the out-of-pocket payment for the services, it was usually referred to as cash and carry. And therefore, if you did not have the cash, you had nothing to carry. And so we brought this act as a response, a positive response to trying to solve the challenge of the cash and carry system. And this was done in 2003. In fact, luckily for me, in my delegation, is my shadow, the shadow minister for health, who was then the minister of health in the previous regime. He's here with me. And even though my Minister of Finance is not here, the chairman of the Finance Committee in Parliament is here. And so all your questions can readily be answered without any reference to any document. The response definitely was focused on trying to get this policy objective solved, securing a financial risk protection against the cost of basic healthcare services for persons resident in Ghana. It's for all persons resident in Ghana. And how did we do it? We decided to get consensus, both sides of the political divide, imply the people in Ghana, for us to up the value-added tax by 2.5%. And so it was taking up to 18.5%, and then that 2.5% was earmarked for health sector financing. And not only did we do that, we also said that the formal sector, which by law, all employees are compelled to contribute an amount topped up by the government for their social security contributions. And so we decided that for the formal sector, each contributor will pay 2.5% of his social security contributions towards the health sector financing. And then the informal sector, we gave a graduated premium payments, starting from the lowest for the poor, and those that are really the poor of the poorest are called indigents, and they were given free health service, health insurance cover. And so we gave a premium of from about 1 point a few cents dollars to about $4 premium. So that is a graduated one. But with this earmarked funding, we are able to rope in about 90% of the national health insurance revenue from the two sources. This is the cash flow, existing cash flow that we have. And you see that the 2.5% from the VAT, which we refer to as the health insurance levy, is the main contributor. But definitely the authority, the National Health Insurance Authority, is given the power to invest the money. And so we get some interest from some investment. And then there are also some other incomes we get from our partners, like the World Bank, who initially was doubting whether we could make it. Now, we definitely are facing some challenges, but my colleague, the National Health Insurance Chief Executive Officer, will be telling you about the success story and the challenges. But this, you can see from the income and expenditure, there's some gap, and therefore we are trying to make some new proposals to try and improve upon it. And we're looking at upping the National Health Insurance levy and other interesting scenarios. Some have been mentioned by earlier presenters. Looking at the contribution of the earmarked fund to the National Health Insurance income, as at 2009, if you put the social security contributions together with the National Health Insurance levy, it works to about 77% of the total funding for the health insurance. And that was 2009. 2010, it works up to about 83%. That is about 18.0 from the Social Security plus the levy, which is 65.1. But by 2011, it's gone up to about 90%, which is the 17.4% Senate contributions to the levy, 72.7%. Now, if you look at the sector, you see the contributions. We definitely, in the sector, are not dependent on the levy and the social security contributions. The government of Ghana still spends and budgets a lot of money for the sector. And so looking from 2008 to 2010, these were the figures that we're getting. But you can see that the sector budget support that we get from our development partners is now on the decline. From 2008, it was about 15%. Now, 2009, 6, and 2010, 6. This year will be about the same. But the National Health Insurance Fund is on the increase, except in 2009 where we had quite a quantum jump for some good reason from 28% to 46%. And 2010, it came down to 34%. You can see we had some HIPIC relief, which is completely dried out now. We had some other earmarked funds, and also the hospitals generate their own funds. And so that the experience we have in Ghana, you will get more from my colleague, the Chief Executive Officer of the National Health Insurance Scheme. Once again, we are grateful for this opportunity, and we can tell you we've learned a lot. Thank you very much.